By the late 1920s, Indiana Hospital emerged as the cornerstone of healthcare for the region. Over the next 70 years, it would undergo 4 periods of growth that established the foundation of today's IRMC. Despite the stock market crash of 1928 and the Great Depression, Indiana Hospital continued to grow to better serve the healthcare needs of the region. With the growth of prepaid hospitalization and health insurance in the 1930s, a wave of expansion began as hospital admissions increased. To respond, the Junior Auxiliary was formed with an emphasis on providing support for children and maternity cases. In 1931, the first new wing was added, increasing capacity to 154 beds. A major supporter of the expansion was John G. McCrory, president of a chain of 5 and dime stores. At the same time, the Dixonville Hospital closes and donates its equipment to Indiana. Membership in the Hospital Association of Pennsylvania and its first electrocardiograph machine followed in 1934. But the hospital was not large enough to apply for interns or to issue diplomas to its nursing students. John S. Mack, president of G.C. Murphy Company, became a driving force to address this deficiency. In 1935, Mack donated 1,500 shares of Murphy's stock to the hospital. 1937 saw the opening of a new nurses' home that included a dietetic training kitchen. In 1939, a second wing opened with 50 new beds, raising the hospital's capacity to 200 beds, 5 times its original size. The Mack wing was designed by local architect Robert E. Tom. Mack's donations included funding to serve those unable to cover the cost of hospital care. In 1938 through 39, over 3,800 patients were treated, with some 1,500 admitted as free patients. With this growth, the hospital could now apply for interns and award diplomas to its students. Polio had long been a major threat, striking numerous people per year, mostly children. President Roosevelt was a victim of the disease. To treat its victims, the hospital acquired its first iron lung in 1942 with the support of community donations. As war spread following the attack on Pearl Harbor in 1941, Indiana Hospital developed a plan to mobilize staff and serve as an emergency hospital base in the event of an attack on the country. With the post-war period came the baby boom. As the population grew and medical advances occurred, the hospital entered a new period of expansion. In 1958, a 10-year modernization program began with a new diagnostic and outpatient wing. Then, in 1966, a 3rd floor was added to this new wing for maternity cases. The new wing would include radiological and fluoroscopic services, surgery and recovery rooms, the kitchen and cafeteria, and other facility support areas. With continuing advances in medicine and the launch of Medicare, the late 1960s saw Indiana Hospital establish in-service education for nursing and compliance training. As a result, the nursing school gained recognition and accreditation from the Board of Diploma Programs of the National School of Nursing. On July 30, 1970, the Visiting Nurses Association was officially organized under the sponsorship of the Alumni Association of the Indiana Hospital School of Nursing and the Women's Civic Club of Indiana. The program would provide at-home services and enable many to remain at home while receiving medical treatment. On Thanksgiving Eve, 1976, a fire struck the nurses' quarters, destroying the complex. While there were no serious injuries, changes in nursing preparation would see the closing of the school. IUP's growing nursing program would fill the gap and become the region's main area for nurses training. The hospital continued to grow, and in 1976, ground was broken for a new 7-story addition called the Tower. In 1979, patients were transferred to the new facility and renovations of the older buildings began. Growth continued in the 1980s with a diagnostic facility in Blairsville, along with the Cancer Treatment Center, the Indiana Dialysis Center, AGH, a partnership with Allegheny General Hospital, and a new maternity facility providing family-centered care. The 1990s saw the MRI, new cardiac and cancer treatments, and the opening of a new outpatient services building in 1992. The progression from its original ambulance to modern EMS care would literally take to the skies in 1994 with the collaboration of Allegheny General to bring Life Flight to Indiana. The late 1990s would see a transitional care facility, sleep disorder center, and bone density testing would be added along with family medicine centers in Cherry Tree, Plumville, Northern Cambria, Mahoning, and Homer City.